Hi, my name is Akosua, a disability and rehabilitation expert and the founder of the Rehabilitation Consult. Today I'm here to talk about early identification of disabilities. When we say early identification of disabilities, they are the method, practices and procedure that are used to identify or determine disabilities in their relations to developmental milestones. It is very important for families, educators and parents and other older adults in the community to recognize developmental milestones of children and also seek early interventions. Somebody may ask, how do we identify these developmental milestones, or how do we identify these disabilities? I am going to divide this identification into 4 parts. That is the physical part, the speech, the visual, and the hearing. I will first speak about the speech. When you have a child at home or a baby at home who stammers, who has a bad speech, who has inappropriate sounding speech, or has incomprehensive speech, it is very important for the mother or the caregiver to seek a speech therapist's attention. I'll move on to talk about the visual impairment. How do we identify visual impairment? When you want to identify visual impairment in your child, at the first 1 month, when you move an object, the baby's eye should follow the object that you are moving at. At 3 months, your baby should be able to move towards when a toy is placed in front or at the side of the baby. The baby should move to that direction of the toy. That is also a way to identify visual impairment in children. Then when you are reading to a child and the child starts moving side to side, his or her head side to side, it means that there is something that you need to check for the visual of the child. So the checklist for visual impairment are as follows. Does your child avoid simple hazard? Does your child has fits? Can he or she feed herself by age 4? Is he or she able to move towards toys when placed side by side or in front of her by 3 months? Does her eye follow object when moved in front of the eye at month 1? Can your child walk properly or well by month 20? Can your child stand without any support by month 18? Can your child sit properly without any support by month 12? Does your child smile to others by month 6? Does your child hold his or her neck steadily by month 6? Does your child blink the eye frequently? Then does your child bring a book right under the eye whilst reading? Or does one eye move differently from the other? If 2 or 3 or all these checklists are yes, you need to consult an ophthalmologist for further examination of your child. So we'll move on to talk about physical disability, and these are the checklists. Is your child able to move their limbs without any difficulty? Is your child able to grasp objects without any difficulty? Is your child able to walk, sit, or stand without any difficulty? Does your child jerk whilst walking? Is there any absence of parts of any of the limbs? Is there any deformity at the neck, finger, hand, leg, and waist of your child? Is there lack of body coordination? If any 2 of these checklists is a yes, you need to seek an orthopedic surgeon for further examination for your child. We move on to talk about hearing impairments, and these are the checklists. Does your child respond when called from another room? Does one ear favor listening? Does your child ask for instructions repeatedly? Does your child has discharge from the ear, malfunctioning of the ear, frequent use of gestures, defective speech, then that's your child's turn when called from behind. If 2 or 3 of these checklists is a yes, you need to seek an audiologist or an ENT specialist attention for your child. If your child is below the ages of 3 and 4 and you find out that any of these checklists is a yes, you need to seek a psychologist attention for further examination of your child. We move on to screening at birth. What do you check out at birth for disabilities? Did it take long for your child to cry after birth? Is your child having a birth weight less than 2.5 kg? Did the mother take any abortion pills or abortion drugs during pregnancy? You examine for clefts at the lip of the child. Then you check out for jaundice for the first 10 days. So if jaundice is present at the first 10 days, then it is very important for you to seek early intervention. One may ask, why do we have to do early identification? We do early identification for early intervention for positive outcomes of development in babies. My final words is that as a mother, when you have a newborn, the checklist, as I mentioned, you look out for abnormalities. If you realize that there is anything that is not normal with your child, you seek for medical attention. If you realize that there is a behavior or there is a deformity or an absence of any of the part of the body, kindly seek medical attention for your baby. Thank you.